Hi, this is Dr. Cheryl McDonald, and you're listening to Health Psychology. In this first portion, I'll be talking about health psychology and its basic foundations. A health psychology position is with promoting knowledge of how biological, psychological, environmental, and cultural circumstances link to physical and mental health. Investigations are beginning to demonstrate that negative emotions such as rage, anger, jealousy, envy, anxiety, and depression have a relationship to one's physical fitness. One common pattern of the mind-body association is when people feel anxiety or stress, the heart rate increases. Overall wellness depends on a healthy brain, mind, and body. In the area of physical fitness and emotional well-being, health psychology concentrates on examining physiological, psychological, sociological, and environmental parts of life, and in what way each of these influence physical health. There are a few who include the spiritual or religious features to this design. However, traditionally the standard incorporates biological, psychological, and social elements. While it may be accepted knowledge among some groups to appreciate the negative impacts that a person's emotional mindset can have on health, there continues to be a remarkable amount of rejection about the functions of the interactivity. Physical health can be directly influenced by the circumstances in which we live, and the principal approach studied within health psychology is the psychosocial design. The British Psychological Society emphasizes that health and sickness are the results of the blending of biological, psychological, and social factors. Biological determinants consist of genetic conditions, the outcome of a physical condition, and inherited personality characteristics. Psychological factors are anxiety and depression levels, personality styles, and lifestyle. Social determinants consist of cultural beliefs, family bonds, and support systems. Health psychology's motives have the belief that everyone merits conventional medical and psychological attention, even when everyday practices, career, or family life stressors add to a reduction in physical fitness and or emotional health. The biopsychosocial model views health, wellness, and illness as being a result of many different interrelated sections affecting a person's life, from biological components to behavioral and social situations. Emotional factors related to physical health have been a general focal point since the beginning of the 20th century. The results emphasize that people who eat proper meals, sustain a healthy weight, do not smoke, drink limited alcohol, get sufficient sleep, and exercise routinely are in better shape, therefore live longer. Psychologists at this time were also finding connections between psychological and physiological processes. These incorporate the physical consequence of stress on the cardiovascular and immune systems, and consequently seeing that the functioning of these systems could improve with training. There was also a rising recognition of the value of having sound communication skills during physician appointments. The American Psychological Association, Division 38, is health psychology, which concentrates on interpreting the relationship between health, illness, emotions, and lifestyle. This division focuses on investigating the psychological determinants that impact health and contributes data to the healthcare management system. The three domains pertaining to health psychology are: 1. Clinical work. In medical and clinical settings, health psychologists customarily conduct behavioral evaluations, engage in clinical discussions, and administer personality tests. They often cooperate in training interventions with individuals or groups related to educating people about anxiety reduction techniques, offer addiction cessation information, and guide people on how to avoid unhealthy lifestyles. Physical health can be influenced by the things people do, by the way they process knowledge, career choice, family dynamics, perceived life struggles, and the conditions in which they live. For example, someone living in a damp, molded-infested home has a real possibility of contracting respiratory or sinus difficulties and may produce a few illnesses. 2. Public policy work. Health psychologists may operate private or government settings and have a position in shaping public policy on health-related affairs. Their concern might point to recommending executive groups on healthcare reform, address inequalities in healthcare, or lobby government bureaus. 3. Research. Health psychologists manage investigations on a variety of health-related matters. For instance, researchers may focus on examining effective preventative actions, search for health promotion methods, study the elements of health dilemmas, develop ways to stimulate people into seeking treatment, and how to help people cope with a disease or emotional distress. Genetics and physical health. Researchers have identified that people whose parents experience specific conditions, such as addictions, hypertension, diabetes, and some cancers, are predisposed to receiving these diseases. Biology unquestionably plays a fundamental role in the fitness and health of everyone. Nevertheless, emotional, environmental, and social circumstances are also pivotal areas that associate to any ailment. For illustration, when a mother is diagnosed with breast cancer, then nearly all medical specialists would urge her daughter to receive screening regularly once she approaches a specific age. It would not matter if the daughter did not smoke or kept away from the damaging rays of the sun. She is a cancer risk on account of the genetic predilection for the illness that appears in the family history. However, there is no guarantee that children of mothers that have breast cancer will experience the same. This only indicates that the DNA, the genetic matter that people share with their family, may hold a marker that leaves her more responsive to the disease than someone else who does not have this marker. Some people born from alcoholic parents manage to have more addictive temperaments than those whose parents were not alcoholic. A few emotional and mental ailments directly relate to the abuse they suffered in childhood. Others tend to be more genetic in quality, though psychological, social, environmental factors all present key notable positions in regulating illnesses along with a genetic tendency. At times when people feel ill, weak, or overrun, or when they catch certain conditions, it is not only in response to a virus or bacteria infiltrating the central nervous and immune systems, but a reply to what is occurring within the body, brain, and unconscious mind. Getting a cold is just one example. Take heart. These teachings clearly do not leave out the biological element indicating the virus that overwhelmed the exhausted immune system. Heart-related conditions, breathing disorders, muscle and joint pain diseases, and various physical ailments are prevalent among those coping with the emotional and mental pressures of modern-day life. The discharge of the stress substances in the body impairs the shields in fighting off an attack. The more people realize the power of the mind, the more they will understand that physical health directly links to thoughts, feelings, and behaviors. One way to explain the basics of health psychology is by examining the smoking habit. Part of the smoking addiction is the physical element of dependence to nicotine, because withdrawal manifestations set in once the process of quitting begins. The standard practitioner will order medicines to subdue the physical addiction signs of withdrawal, approaching the smoking addiction only as a physical problem. However, investigations reveal that there is an exceptionally strong likelihood that the person will just start smoking again. A chain smoker that uses a nicotine product may have trouble stopping if they continue to think that smoking is not harmful, or if smoking helps them unwind. In these situations, even with the product, the smoker may simply return to the practice. The average advisor or physician is only managing the physical withdrawal aspects of smoking. There is a psychological element to the addiction, because the smoker stands to achieve compensations no matter how brief from each cigarette. Smoking may stifle the appetite, extend an opportunity to relax and unwind, or produce a temporary diversion to current stresses. There is likewise a behavioral slant to smoking, such as having a cigarette right after dinner, using a cigarette as a stress reliever, or regularly lighting up when getting into the car. Every year, investigators are finding novel insights into how the brain, body, and mind interrelate, and the means in which they connect to each other in harmony. The human brain is one of the most obscure, mysterious, and influential organs of our entire creation. Science has been able to conjure up ideas in the mind, such as concepts in mathematics, and imagine worlds that at this time do not even exist. These thoughts stem from people wanting to explore the unknown aspects of the mind, which has a relationship to the brain and the environment in which we live. There is a distinct respect for what the mind is capable of achieving in relationship to the brain, medicine, and psychology. Science understands much more than even 20 years ago regarding the interaction between emotions and pain, of the thought processes involving healing and the remarkable healing powers of the human body. Community and cultural factors. Modak, Stroop, and Gerbending reveal that 50% of all deaths in the United States can be associated to ways of life or other risk determinants that are, for the most part, preventable. Health psychologists work with individuals in hopes of eliminating these risk factors to decrease failing health and improve overall health. Expectations and gender roles can put a large amount of pressure on someone to behave and act in a distinct fashion. Racism and religious factors often are stressors in people's lives, and over time these pressures have an impact on overall health. For example, white middle-class people tend to have better overall health than inner-city minorities. Health psychology explores the underlying factors that have a direct and indirect impact on quality of life. When assisting people develop a healthier lifestyle, career choice is another area that health psychology explores. There is a direct relationship between choices of work and physical and emotional health, because the more frustrating the project, the more risk people are placing themselves into developing an emotional and/or psychological illness. When someone is under stress, the body produces chemicals and hormones that it does not require, and some of these substances may be harmful. The difficult conditions and the release of these substances results in a weakening of the immune system. When an immune system is weak, people are more susceptible to physical and mental ailments. The psychosocial model as it applies to health psychology. Millions of people all over the world are under tremendous amounts of stress because maybe their economy is suffering and their unemployment rates remain high. People who are unemployed are working more hours and are taking on more responsibility for less pay. Those that have lost their jobs worry about paying their bills, feeding their families, and holding on to what they have worked so hard to achieve in the past, and some are wondering if they are normal. When health psychologists talk about the biopsychosocial model, behaviors are key ingredients contributing to physical health. Do people smoke? Do they drink alcohol regularly? Do they eat junk food? Have a stressful job? Are finances tough? Do people exercise regularly? How's the family? How's the social life? These are just a few questions that a health psychologist may explore. There are behavioral and social conditions that directly or indirectly relate to the state of overall physical health. Stress derives from the instinctual nature of the desire to survive, and the psychological community labels this concept the fight or flight response. When the mind perceives a warning to the body, whether that threat is real or a product of the imagination, the brain responds as if in danger. The brain calls for adrenaline to be pumped throughout the body, which allows it to run faster, away from the problem, or fight with a bit more strength than it naturally possesses, face the problem. The production of adrenaline in association with the fight or flight response is only intended to be for brief periods of time, for survival. When people are facing chronic stress at home or work, the physical body is under constant tension, adapting to this fight or flight response. As a result, people tend to feel run down and tired more often. They may experience aching joints, muscle aches, lower back pain, headaches, and increases in blood pressure, all of which are the common side effects of repeated stress and increases in adrenaline. While some in the health professions do not tend to think about stress as being abnormal, it does indeed take a heavy toll on a person, both physically and emotionally. One key factor in lowering the stress level is determining how an individual recognizes and responds to stress, and how this stress relates to their quality of life. Health psychologists work in clinical settings promoting behavioral change that relates to the everyday anxieties of life. They also inform the public, conduct research, teach at universities, and work in the field of sports medicine. While sad or anxious feelings may not directly cause poor physical health, they are certainly contributing factors associated with health and an individual's enjoyment of life. The field of health psychology focuses on promoting health, which includes the prevention and treatment of physical diseases. The health psychologist's focus is on understanding how people react, cope, and recover from illness, along with improving the quality of lives of those with chronic and terminal illnesses. When there is little hope of recovery, it is a health psychologist who can improve the quality of existence by helping those involved work with loss and recover at least some sense of emotional well-being. one other interest is with identifying the best ways for providing therapeutic services for the bereaved in coping with the loss of a loved one. Clinical health psychology strives to produce answers to the following topics. 1. How should a particular disease be treated? 2. What is the connection between the body, mind, and environment? 3. What role does psychology play in the relationship to health and disease? 4. What is the relationship between emotional health, physical wellness, and disease? The world of health psychology is changing lives one day at a time, and with some expert guidance and support, people can experience the healthy, vibrant life that they desire. And all it takes is unlocking the secrets of the brain, the body, the mind, and behavior. The simple fact of life is that human beings are extraordinarily complex, and an illness can be the result of a myriad of factors. These factors emerge from biological, psychological, and environmental facets of daily life. Most often, medications alone will not provide the positive results necessary for people to achieve maximum health. But just because medicines do not fully aid in recovery or reduce, say, the pain, does not mean that all options for improvement have been exhausted. Health psychology principles clearly have not been fully utilized or recognized at this point in time by conventional Western medicine. Chronic pain and illness. Physical ailments are real, people will say. They're not in my head. Some patients and physicians view health psychology concepts as being a personal affront to gaining knowledge and do not believe that pain relates to overall emotional well-being. Others fear that people working in the health psychology fields will judge them or their pain as being abnormal. A few medical professionals try to discredit patients' complaints of pain and intimidate people into attempting to make them think that the problem simply does not exist and that the pain is all a figment of their imagination. Science is evolving, and the problem may simply not be medically understood, or the location of the pain cannot be found in the body at the time. There is a relationship between the brain, the mind, and pain. Health psychologists attempt to assist in the matter of communication between doctors and patients during medical consultations. There are many difficulties in this process, with patients showing a significant lack of comprehension of many medical terms. One central area of investigation relates to doctor-centered consultations, which are directive and involves the one seeking help answer questions and performing less of a part in decision-making. Many people object to the sense of authority or disregard that this spurs and favor patient-centered consultations, which focus on the patient's needs. Patient-centered consultations involve listening to the person completely before reaching a decision, and the one seeking help plays an active role in the process of choosing treatment. Health psychology strives to find strategies to decrease and do away with pain, as well as have knowledge of pain peculiarities such as analgesia, causalgia, neuralgia, and phantom limb pain. Despite the fact that measuring and reporting pain are difficult and questionable, the McGill Pain Questionnaire has helped make improvements. Treatment for pain are patient-administered analgesia, hypnosis, biofeedback, and cognitive behavioral therapy. Do not be tricked into believing that an illness is a figment of the imagination, because this belief may cause psychological problems and increase physical symptoms. The above thoughts are generalized examples of what it means when people say healing comes in part from the underlying psychological aspects of the mind, thoughts and emotions, behaviors, and the brain. Clinical health psychologists identify this way of thinking as being a biopsychosocial model. The standard encourages a positive shift in the way people think about health, illness, and healing. Imagine by changing the way people think and cope about a problem in life that can move patients in a direction towards pain-free living or assist in decreasing blood pressure. People can achieve this by learning a few techniques, and applying and believing in this theory will increase the quality of life. While healing with health psychology is certainly much more complicated than just changing a thought or behavior, most people do not believe in this concept, and until recently it's been overlooked by those in the medical community. A difficult task for health psychologists is motivating people to adhere to medical direction and follow the treatment plan. This lack of adherence is possibly due to treatment side effects or life circumstances, and some ignore taking medicines or consciously stop. Compliance measures are hard to quantify, However, studies explain that this could improve by tailoring medication schedules to an individual's daily life. Health psychologists have advanced training in a variety of research designs, which allows them to conduct investigations, provide expert consultation, or collaborate on research. These specialists conduct research to clarify puzzling questions such as 1. How is stress connected to heart disease? 2. What are the impacts or influences on healthy eating? 3. What are the emotional consequences of genetic testing? 4. In what ways can therapists help people reach their goals and change health habits to improve health? 5. How does an illness affect a person's emotional happiness? Stressors can lead to depression, reduced self-esteem, and anxiety. 6. This field also concerns itself with improving the lives of those with terminal illness. When there is little hope of recovery, these therapists can improve the quality of life by helping recover thoughts and feelings associated with psychological well-being. These therapists also identify the best ways to provide therapeutic services for the bereaved. Health psychology is a relatively new subcategory of psychology and is not well known to many people. These clinical psychologists take a more effective approach by exploring the physical, psychological, and behavioral aspects, considering the problem in a holistic fashion. The practice of using health psychology principles significantly improves the likelihood of successfully quitting any addiction. Specialists can help people become more physically fit, assist with decreasing chronic pain, improve the quality of life with those diagnosed with a terminal illness, prevent further complications of any serious physical ailment, and assist in learning new ways to cope with the tensions and transitions that govern everyday life. Although slowly changing, health psychology principles and cognitive behavioral therapies continue to be overlooked by the general population and the medical professions because these methods require the physician to be aware of other successful treatment modalities. Health psychology principles require individuals to make a commitment to take responsibility for their own physical and emotional health. Until these principles are accepted by the medical community, and until the client begins to follow these principles, the emotional and physical conditions will continue to ravage society. When people become aware of their feelings or emotions, they then need to determine how they're going to manage or control the feeling. Sometimes feelings are not true or based on facts, and people can perceive situations incorrectly because they're products of the imagination. If the feeling is not based on fact, then attempt to undo this misperception, because people are only hurting themselves. Try not to get caught up with feelings of shame and guilt, because these emotions are a waste of valuable time for most of us and are products of the imagination. However, for short periods of time, if imagination or dreaming makes people happy, of course it is acceptable to enjoy the feeling. Just remember that this is wishful thinking and that people are tricking themselves into feeling pleasure. To learn new ways to cope with feelings associated with physical health, start with small baby steps. For example, if there is a problem with anger, attempt to be aware of the feeling and take a few deep breaths before reacting. Tactile stimulation and how touch relates to health psychology. Touch has appeared as an essential component for benefiting growth and development in a wide range of animals, from worms to rat pups to human infants. Developmental lag is prevalent in children denied of ordinary stimulation, for example, in premature newborns and some institutionalized children. Orphaned newborns who endured the harshest of circumstances in Eastern Europe institutions demonstrated impaired growth and cognitive maturation, as well as an increased rate of severe infections and attachment difficulties. Numerous investigations have recorded physical stimulation promotes growth and development in children denied touch. This evidence details the value of touch in child development and suggests the probability that these orphaned newborns are not enduring maternal deprivation, but they are experiencing sensory loss and specifically a withholding of stimulation related to touch. In pioneering investigations on human infants, Hopper and Pinot observed that 10 minutes of added physical handling per day produced a notable decline in regurgitation. Kastler also noticed that institutionalized infants that were given an extra 20 minutes of holding per day for 10 weeks had higher scores on developmental evaluations. As stated, extensive research has confirmed that tactile stimulation is essential for growth and preservation of physiological and emotional regulation in newborns, children, and grown-ups. Employees who received massages recorded a meaningful decrease in blood pressure, stress, and work-related anxiety, and had improved rates and correctness on math examples. Sufferers with ailments ranging from burns to eating disorders have been shown to benefit from massage therapy. All displayed declines in stress hormone levels, anxiety, and various clinical symptoms. Touch is an essential element of human development, a critical method of expression, a significant factor in the health and growth of infants, children, and adults, and a powerful healing force. The subject of touch in therapy can clearly be viewed by some as being a danger of entering a slippery slope arena, particularly to those who adhere to psychoanalytic teaching. Zur and Nordmarken state that the decision to touch or not to touch is dependent upon the client's personality, diagnosis, symptoms, culture, gender, history, as well as the concept and relationship and the training and awareness of the therapist. Inappropriate touching can be damaging, as can be the harsh and aimless avoidance of touch. Touch is a fundamental exercise of human beings and has tremendous value and has a definite potential for being included in psychotherapy. To paraphrase, a kiss may be just a kiss, and a sigh may be just a sigh, but a touch can transform at least the central nervous system and maybe someone's life. Health psychology and mindfulness. Psychological interventions that focus on meditation or mindfulness have become increasingly widespread. Those that practice mindfulness state that this type of meditation enhances their physical well-being, decreases cognitive reactivity, and reduces avoidance behaviors. Mindfulness-based stress reduction was created in 1979 by John Kabat-Zinn at the University of Massachusetts Medical Center to teach sufferers with chronic medical ailments how to improve the quality of their life and develop healthier lifestyles. Grossman and colleagues conducted a meta-analysis of 20 investigations in a broad array of clinical groups and noticed uniform improvements in anxiety, depression, quality of life standards, and coping styles. Mindfulness is accomplished by the application of meditation and is a self-directed exercise for relaxing the body and quietening the mind by concentrating on present moment experiences. The importance of mindfulness is staying in the present moment and holding a non-judgmental way of acceptance. Practicing this technique seems to improve immune system functions, reduces inflammation, and lessens the reactions of the autonomic nervous system, increases brain functions, and leads to higher levels of melatonin and serotonin. It improves the quality of life for people diagnosed with chronic pain, fibromyalgia, and those who have HIV. It helps people cope with the diagnosis of diabetes and cancer. Using mindfulness-based approaches seems to improve symptoms of irritable bowel syndrome, chronic fatigue, hot flashes, insomnia, and cravings of those with addiction problems. Mindfulness-based stress reduction was designed to be an organized group gathering that applies mindfulness meditation to relieve distress linked to physical, emotional, and psychiatric problems. The treatment is non-religious and focuses on an orderly method to develop and enhance perception of moment-to-moment awareness of mental states. The program believes that elevated awareness will produce more authentic insight, decrease negative emotions, and will promote endurance, leading to an improvement in coping skills. Numerous investigations seem to verify many of these claims. Mindfulness-based stress reduction programs were designed to be an 8-week intervention that centers on teaching breathing techniques, yoga, mindfulness meditation, and other relaxation practices. In this last section, I'll be talking about some tips for taking care of emotional and physical health. 1. Take care of yourself physically. Many people do not understand the fact that when they take care of themselves physically, they also take care of themselves emotionally. There is a relationship between neglecting the body and the development of emotional and physical problems. This creates a toxic cycle. To end this cycle, strengthen the body with enough rest, food, and liquids. Make sure that there is enough air, nutritious food, and exercise in life. Warm and refresh yourself when needed. Become aware of what you're consuming. A healthy, proper diet is beneficial for the body and mind. Research has proven that exercise improves mood and has numerous benefits for physical and emotional health. I am, of course, aware that this is limited information. However, many people do not understand these basic facts. People do not have to be perfect, and try not to let physical care become an obsession, which may then become another problem. Consider the fact that when people ignore the physical needs of their body, this abandonment will create an emotional and physical problem, which in turn creates a toxic life cycle. Therefore, people feel physically and emotionally unstable. 2. Pay attention to body signals. When the body is in need of something, we experience feelings that correspond to what the body is lacking. One example of ignoring a signal is when people do not pay attention to hunger when trying to lose weight, and they begin to starve themselves. This starvation in turn slows down the metabolism and will, in the long run, prevent weight loss. The body sends messages when to eat, sleep, relax, calm down, play, and comfort. Go to bed on time. Lack of sleep strains the heart, may increase weight, and undeniably sparks up the crankiness meter. Do not ignore the protective bodily signals and listen to what it's saying. 3. Be socially active. The bottom line is that love and attention are almost as valuable as the air that we breathe. Most will crave it unless they receive it, so seek it out for emotional health. Take the time out for relaxation and socializing, because this is useful for emotional and physical health. Give and receive love and attention to both others and yourself. As quoted from C.J. Lewis, affection is responsible for 9/10 of whatever solid and durable happiness there is in our lives. People are social beings from birth to death. 4. Take care of yourself with relaxation. People should be spending 1/3 of their time on leisure and/or play. Relaxation is another form of nurturing mental health because the mind needs the opportunity to recharge. People also need time to process or understand thoughts and emotions. If someone stays busy all the time, then they are not giving themselves enough time to process and strengthen the brain, mind, and body. If 1/3 of the time is too much to ask for, then at least set aside an hour or 2 a day. Set aside some time to relax and have some fun. 5. When you fail at something, have the courage to try again. Everyone makes mistakes in life. Try to work at forgiving yourself for making those mistakes. Trying again improves self-esteem and creates an overall sense of feeling empowered, which in turn increases endorphins, thereby lifting the mood. 6. Visit the appropriate doctor, the one that is the perfect match for the condition. Going to the appropriate doctor can make all the difference in overall health, especially if there is a complex illness that requires a specialist. Try to be open to seeing a mental health professional, especially if feelings and emotions are getting in the way of recovery. Unhealthy behaviors, from smoking cigarettes and poor diet to living a sedentary lifestyle and having inadequate coping skills, are all significant factors leading to disability and may shorten life. Take the time to care for both the mind and body, because everyone has the ability to make positive changes by choosing to develop and enhance specific ways to live a physically and emotionally healthy life. Clinical health psychologists assist in disease prevention, help those adapt to a medical diagnosis, aid those in managing the loss of a loved one, and enhance the quality of those who are faced with the loss of their life. This is Dr. Cheryl McDonald of Health Psychology, and thank you for listening to Health Psychology and its Basic Foundations.